Eternal youth and a healthier, longer life. From celebrities having stem cell injections to look younger to claims of healing and anti-aging, what is really true about what you should know before considering any stem cell therapy? Dr. Ernst von Schwarz is a world-renowned triple board-certified clinical and academic cardiologist and clinical professor of medicine at UCLA and UC Riverside. He's also considered a worldwide pioneer in the field of stem cell research. So Dr. von Schwarz, thank you so much for being here. I am so interested in this topic. So tell us how stem cell therapy can help you live longer, look younger, and how you treat disease with it.
It is very exciting. This is really changing the paradigm of medicine nowadays from what we call reactive medicine, where we react towards symptoms and pain and signs of diseases, to what we call regenerative medicine. Stem cells have the ability, theoretically, to basically create every single organ in our body. They are responsible for creating an entire organism. So we use stem cells in the experimental setting right now to try to regenerate damaged organs, whether it's the heart, the brain, the skin, you name it.
Yes, I have seen this trend more often with clinicians about not just treating what people have already or symptoms that they have already, but trying to improve health before it actually deteriorates. So what are celebrities, okay, do the celebrities know something we don't? Why are celebrities having stem cell treatments?
Because it is probably the source of the fountain of youth. Let me just say one thing. Stem cell therapy at the current time is not FDA approved. We know that. However, it's still used. It's not forbidden. It's just relatively regulated. With regard to anti-aging, which is not really a medical term, however, I mean, we know that stem cells have an enormous potential, especially for regeneration of the skin cell. Before they go to auditions or before they go to the red carpet, they come to us. They have injections into the face or for hair loss, you name it, and they shine and they look flawless and they look 20 years younger. This is the power of stem cells. It does work.
Yes, they have the tools. So if you're ever wondering, why you don't look like that, they have the access and the tools to some of the best science around. So let's talk about the known benefits and risks of stem cells.
Well, there's a couple of things what stem cells do. So number one is they have anti-inflammatory properties, meaning if there's an inflammation anywhere in the body caused by a heart attack or any damage, even arthritis or so, they have anti-inflammatory properties and that relieves the pain. Secondly, they are angiogenetic, meaning they have the ability to create and build new blood vessels, capillaries and arterioles, and those new blood vessels contribute to an improved circulation and perfusion with oxygen, which also contributes to healing processes. And thirdly, they have, at least in part, some ability to regenerate and rebuild damaged tissue. That's why we are using them experimentally in certain disease conditions like acute heart attacks or strokes or neurodegenerative diseases right now in clinical studies, but also for the skin, as I mentioned before. And lastly, they probably have also the ability to stimulate our own stem cell production in the bone marrow. That's why it's probably a long-lasting effect.
Okay, so many ways that we think that stem cells can help with health and to regenerate some of those cells that we need to look younger and feel better. But you mentioned that it's not FDA approved. So how are doctors able to use them right now? But you are not the first clinician or the first doctor that I've spoken to that's using it right now. So how are you guys using it in your practice?
Well, we use it for certain diseases only in the frame of clinical studies. You have to have a study protocol basically in order to use it, and we have to report the data to the FDA, and we have to basically publish those study results. Every single study, keep in mind, using stem cells for whatever clinical condition or disease, whether it's an acute injury or chronic diseases, has shown significant benefit so far. So it is very, very promising. Besides that, we are, of course, against what is called medical tourism, that people fly all over the world to get some unapproved therapies without quality control. This is really not recommended. And of course, you have to, that's written in the book, The Secret World of Stem Cell Therapy. There are certain questions everybody should ask the physicians who want to do stem cell therapy. You have to really investigate a little bit about their scientific reputation, their background. What did they publish in the field so far? What is the source of the cells? Are the labs where the cells come from really following the appropriate regulatory requirements and hygienic requirements? And we have seen a lot of flaws in this regard over the last year. So you have to be a little careful. You have to know where you're going. You have to know how to ask the right questions. It is not forbidden to do it, but the FDA, of course, is not recommending anything because of lack of large-scale data. So our task as physicians and researchers at this point is really to do more and more clinical studies with larger number of patients to really prove the benefits compared to placebo, for example.
Dr. Ernst von Schwarz, thank you so much for being here today.